Mental health in underserved communities, culture, and economics. When we talk about mental health, most people think about personal struggles like stress, depression, or anxiety. But what many don't realize is that where you live, your cultural background, and your financial situation play a huge role in whether you can actually get the help you need. In underserved communities, mental health challenges are often made worse by stigma, poverty, and limited resources. In this video, we'll look at how culture and economics shape mental health, and more importantly, what people in these situations can do to cope and seek support. The role of culture. Culture deeply influences how people view mental health. Stigma. In many communities, mental illness is seen as a weakness instead of a health issue. For example, someone dealing with depression might be told to pray harder or snap out of it. This creates shame and prevents people from asking for help. What you can do: start by talking openly about mental health with people you trust. Even small conversations help break the stigma. Mistrust of the system. Many marginalized groups have experienced discrimination in healthcare. This leads to mistrust and fear of not being understood. Example: a Black patient may avoid therapy because they feel the provider won't relate to their struggles. What to do? Look for culturally sensitive providers or join support groups led by people with shared experiences. Language barriers. When mental health services are not available in a person's native language, it becomes hard to explain feelings. This can lead to wrong diagnoses. What to do? If professional help in your language is hard to find, try community organizations or online platforms offering bilingual support. Economic barriers. Finances are one of the biggest obstacles to mental health care. High costs. Therapy sessions and medications are expensive, especially without insurance. Example: a single parent working 2 jobs may choose food and rent over therapy. Poverty and stress. Financial struggles increase the risk of anxiety and depression. And when mental health declines, it becomes harder to work, creating a cycle. What to do? Explore low-cost resources like nonprofit counseling centers, hotlines, or group therapy. These are often more affordable. Culture and economics heavily affect mental health. From stigma and mistrust to poverty and high costs, underserved communities face unique challenges. But small steps, like open conversations, seeking culturally sensitive support, and using community-based resources, can make a real difference. If you or someone you know is struggling, remember, you're not weak for needing help. Mental health is just as important as physical health. Start where you are, use the resources available, and keep pushing for better support. Geography and resources. We explored how culture and economics affect mental health in underserved communities. Now, let's look at 2 other powerful factors: geography and resources. Where you live and what's available around you can either support your mental health or make things much harder. Let's break it down. Geographical challenges. Where someone lives can shape their mental health journey. Urban versus rural areas. In cities, people may face high stress, noise, and fast-paced lifestyles that fuel anxiety. In rural areas, the problem is often lack of access to mental health professionals. Imagine having to travel 4 hours just to see a therapist. That discourages people from getting help. What to do? For rural residents, telehealth services can be life-changing. Even if internet is limited, some phone-based counseling services are available. Unequal distribution of resources. Most therapists and clinics are based in cities, leaving small towns without proper services. Example: a young farmer in a remote village may struggle with depression but has no local counselor. What to do? Community groups, churches, or schools can serve as safe spaces for peer support until professional help is accessible. Lack of resources. Even when people want help, the resources may simply not exist. Limited workforce. There's a global shortage of mental health professionals. For example, in some regions, one psychiatrist may serve thousands of people. What to do? Online therapy apps, mental health hotlines, or peer support groups can bridge the gap. Inadequate care settings. Some facilities are underfunded, overcrowded, or even unsafe. This can discourage people from seeking help. What to do? If formal care feels unsafe, try grassroots organizations or advocacy groups in your area. They often provide more supportive environments. Medication shortages. Even essential medications like antidepressants may not be available or affordable in underserved regions. What to do? While medication is important, lifestyle habits like regular exercise, mindfulness, and strong support systems can provide stability while waiting for medical treatment. Geography and lack of resources create huge barriers for mental health care. Whether it's long travel distances, few professionals, or medication shortages, these challenges are real. But through telehealth, peer support, and small community-based solutions, people can still find ways to care for their mental well-being. Underserved communities face unique struggles, but remember, lack of access doesn't mean lack of hope. Every step you take toward caring for your mind matters. If you found this helpful, don't forget to like, share, and subscribe for more content on mental health and recovery.